Welcome to MFP Live. I'm Donna Ladd, the editor of the Mississippi Free Press, and I'm here with my co-host and co-founder, the publisher of the Mississippi Free Press, Kimberly Griffin.
Hello, hello.
And we're very excited tonight to have another one of those real kind of in-depth conversations, Q&A answers that people are looking for out there as we're kind of going through this COVID crisis in Mississippi now. And our guest tonight is Dr. Anita Henderson, who is the president of the Mississippi chapter of the American Academy of Pediatrics. And she is a pediatrician in Hattiesburg, I believe, which she's going to tell you guys a little bit more about. And I will say very outspoken on children and COVID safety, as someone in her position would be expected to do. So welcome, Dr. Henderson. We're very happy to have you here tonight.
Thank you guys for having me. I'm very happy to have the opportunity to talk about children and COVID-19.
Well, why don't you just start us out a little bit? Tell folks what you do other than kind of run this Mississippi chapter, about your work a little bit, where you're from, how you landed in Mississippi doing what you're doing now.
Sure. So I am originally, my family's from India. I was born in Africa, moved to Starkville, Mississippi when I was 2. My dad got his PhD at Mississippi State, so I'm a tried and true Bulldog fan. But I went to Mississippi State and got my undergrad degree in biochemistry there. Went to medical school at UMMC in Jackson, where 2 of my classmates were Dr. Luann Woodward and Dr. Mary Taylor, who run the Children's Hospital and UMMC. So I'm very comfortable communicating with them on a regular basis about kids' issues. And then I did my training in pediatrics at Vanderbilt, where I met my husband, who is a neonatologist. We moved back to Hattiesburg, or we moved down to Hattiesburg 25 years ago this month. So I've been a pediatrician at the pediatric clinic, which is a service of Hattiesburg Clinic, for the last 25 years.
So one of the things is we're getting these kind of startling numbers every day. Can you talk a little bit about what's happening on the ground with children and COVID throughout Mississippi?
Absolutely. So over the last month in particular, we have seen with children, just as we have seen with adults, a significant rise in the number of cases of COVID-19 with the Delta variant. So last year, when we talked about coronavirus, the original SARS-CoV-2, the focus was really on adults, and in fact on the elderly, on nursing homes. We really were focused on that vulnerable population and keeping them safe. And then when the vaccines came out, they were our first priority. So kids in general did pretty well last year with coronavirus. But this summer, what we saw was just a very sudden uptick with the Delta in kids. And in fact, in the last month nationally, there's been a 400% increase in COVID cases in kids. And we're seeing that in our practice here in Hattiesburg as well. And that graph that you are showing illustrates hospitalizations of children under the age of 17. And so you can really see from the beginning of July to now, we have really quadrupled, and that curve is going straight up. So that is why we are really concerned about kids and COVID-19 right now. And schools have just started. In the Pine Belt, they started a few weeks ago. So we're seeing more cases, school outbreaks, and that's why we're really talking about COVID-19 in kids.
Right. Over the last however many days it seems the story of Michaela Robinson has really captured many Mississippians and many Americans' hearts. and as you talked about, your medical school colleague, Dr. Woodward, basically called out Mississippians this week for allowing this crisis to get to this point. Where do you sit as a pediatrics expert? What has to happen to reverse the trend so that we can save our kids?
Mhm. So where we are right now is we have some really good tools. We have the ability to turn this thing around in Mississippi. And the one good thing I will say that has happened over the last month since we've seen the rise of Delta is that we're also seeing a new interest in vaccinations. We've been talking about vaccines, since December and January for the adults, and since May for the children down to the age of 12. So the one good thing that has happened over the last month is an interest in vaccinations. So as a pediatrician, I really want parents and I want all the adults out there to think about what are all the tools that we have in our toolkit to protect our children right now. And so the number one tool out there right now is the vaccine. It's available for all children age 12 and up, but only about 12% of those 12 to 15-year-olds are fully vaccinated. Only about 16% of the 16 and 17-year-olds are fully vaccinated. Only about 22% of those 18 to 24-year-olds are vaccinated. So we have a lot of children within our school system, within our state, who are not vaccinated. And so we can talk about vaccines a little bit further, but that's the number one thing to help prevent the transmission of COVID. The second thing that parents need to do and should do to protect their children right now is to have them wear masks within the school setting. So many schools have now gone to masks within the school settings. They may not have started that way, but many of our school districts have now adopted masks within the school setting. So, as pediatricians, we talk about how children learn. Children learn by their parents. They watch their parents and how they act. They model that behavior. And so our children over the last year, over the last 18 months, have done a great job wearing masks within the school system and within our offices. So children can do this. They want to be in school. And so that is our second tool in our toolkit to protect children.
Right.
The third thing that we can do right now is avoid those unnecessary group gatherings, particularly the ones that are indoors. If it's not necessary right now, just put it on the back burner. Just postpone it. So avoiding those things that are unnecessary at this moment, that's another thing that we can do. Within the school system, a lot of parents want to know what can they do within the school system. So I would just ask them and encourage them to talk to their teachers, talk to their administrators about what is happening within the school. Social distancing within the school in terms of a 3-foot distance in the classroom. Ventilation is important within the school system. Using outdoor activities, doing things outdoors when possible is always another layer of protection. So there are lots of things parents can do within the school system to help protect their kids.
So I do have a follow-up question to something you just said. We had a public school teacher that talked about some of the conditions in our public schools, which they don't have proper ventilation. So they've, and they don't have maybe the room or the space to properly be socially distant. What do you do about those situations where just the school's physical structure doesn't allow for optimum COVID protocols?
There are a couple of things that can be done. Yesterday, the Department of Ed actually announced the ability of schools to switch to that hybrid model if they did not have enough room for that social distance in order to get those 3 feet. There are also things that schools could put within a classroom to help with ventilation. There are filters, there are HEPA filters that are really pretty high quality, and some of them are fairly low cost. I know some school systems have funds and money available that they could tap into to use some of that to improve the filtration within their school system. So, I would encourage parents to ask about that classroom. What are they doing within that classroom, and what could be done to improve the ventilation and the physical ability within that classroom to stay safe?
Okay. Donna, you're on mute, Donna.
One of our readers had posted on our Facebook feed, can you explain the science behind masking in the schools? Is all the public controversy about it really all about mask, or just misplaced anger and a desire for normalcy? What's your take on that?
Last year, within our Mississippi schools, we had a mask mandate, an executive order for the entire year, and it really worked well. We had some schools that had to go hybrid. We had outbreaks here and there, but for the most part, most of our children were learning in person. And so they were able to wear masks. They were able to learn in person for the entire school year. The masking controversy, it's really interesting. I don't quite understand it. There are a lot of people who are asking if masks are dangerous for children, and they're asking if it is harmful for kids' development. And I have talked with a number of pediatric developmental specialists who all say no. A mask on a child for the school day does not harm their development. What is more harmful for children is if they are having to learn virtually, if they are behind a screen all day long. You and I know when we're on Zoom calls or calls via a screen, it gets tiring, it gets exhausting. So we would much rather have our children learning in person, wearing a mask, as opposed to having to learn virtually behind a screen. Another person posed a question to me about the health of children wearing a mask, because some people have claimed that masks are bad for a child's health. In fact, last year, we did not see flu. We did not see RSV last winter. We had very few cases of respiratory illnesses, pneumonia. In fact, our pediatric clinics were pretty empty last winter.
Wow.
We didn't have sicknesses. We didn't have children who had ear infections.
Wow.
But now, once masks came off through the summer, and another question that someone posed was about RSV. We saw and continue to see a lot of RSV this summer. So masks last winter did not harm children in terms of their health. It actually helped them. Last winter, there was a 40% drop in ER admissions for asthma for children.
Wow.
The masks helped them to not have all those respiratory illnesses. Another thing people have asked about is development. Like, how do children learn if they are wearing a mask, or if their parent is wearing a mask, or if their preschool teacher is wearing a mask? How are they learning if they're not seeing those social cues and seeing that mouth? In fact, studies have shown that visually impaired children who may be blind or have vision problems, they learn hearing and they learn speech and language development at the same rate as children who can see.
Wow.
So seeing your mouth is not a requirement for learning language.
Wow. That's fascinating. One of the things you're talking here that reminds me of was our conversation with Dr. Dobbs, when he kept emphasizing that nothing, no one precaution can make it 100% sure that you're not going to get the virus, but that people should think about it as risk reduction. Like, how can you add up different kinds of safety precautions to make your risk a lot lower, right? And so it's, I like to hear, what I'm hearing here is you kind of breaking down in much the same way he did, how to do that, but with your children and inside the schools, right?
That's right.
Because it seems like a lot of the conversation out there, especially in the, social media and all this, it turns into, well, this isn't 100%, this isn't 100%, this isn't 100%, so it becomes this debate between, well, that doesn't work all the time, but it feels very important to say to people that what we're really kind of doing is stacking up our odds in some ways.
That's right.
So if you want to add to that.
Yeah. We talk about a layered approach. We talk about layers of safety. So for kids, our layers of safety are vaccines, masks, physical distancing, hand hygiene, ventilation, outdoors. Those are some of the layers, and avoiding unnecessary. It's just like my car. My car has an airbag. It also has a seat belt. I also drive the speed limit, and I also don't drive if there is a hurricane or tornado. So there are things that we do when we drive that makes it more safe. There are things that we do with COVID that are going to make things more safe. So it's a layered approach for safety.
Yeah, no, that makes, I like that layered between the risk reduction and the layered approach. I mean, that makes a whole lot of sense to me. Now, I feel like I have to ask you this here before I kick it back to Kimberly. I was just listened to the end of the governor's press conference, and I'm not going to draw you into political conversation at all, but one of the things he said struck me. He was very, very, kind of defiant, I guess. I'm not, as governor, going to tell every single school in every single school district what they can and cannot do to keep kids safe. Now, I know that you have been fairly vocal that you would like a statewide mask mandate. And then you're saying to us tonight that it sounds like at least did you say most of the schools are requiring masks at this point in the state?
Dr. Byers told us on a call this week that of the 800 schools that have reported their data on COVID and quarantine, 600 out of those 800 are now masking within the schools. But that doesn't include, there are actually about 1,500 schools in the state. So not all the schools are reporting their data yet. Now, the only issue and the thing we're concerned about is how long is that going to last? Some schools are doing this like 2 weeks at a time. We're going to have a mask mandate for 2 weeks and then reevaluate. And we just know that the Delta variant is not going to be gone within 2 weeks. And so I'm very thankful that those school districts, that those school superintendents, that those school boards have instituted masks within the school system. And I would just encourage them to look and continue to look at the data before they think about removing those masks within the school.
Wow. Dr. Dobbs said during a press conference on August 13th that about 5% of children who get COVID-19 suffer from long-term complications. We often call it long COVID. But you told Hattiesburg's mayor during a conversation in July that you're seeing about 10 to 20%. I know that's anecdotal. Dr. Dobbs also said that they have some preliminary, not data, but maybe even anecdotal, that it will affect, it is affecting and has affected some young people's reproduction ability. Can you talk about all that? Because I think a lot of times what happens is a young person gets COVID, they seem fine, after being sick for a little bit, and we're all relieved and we move on, but we don't really have a full grasp on what that long COVID and how that's going to affect, and all the things that will affect them in 10, 20, 1 year, 2 years.
Right. So we do see long COVID in kids, and it's got a lot of different names, long COVID, but in the pediatric population, we're trying to use the term post-acute sequela of COVID, PASC, post-acute sequela or symptoms of COVID.
Okay.
And so Dr. Dobbs mentioned that 5%. What we have seen, and on pediatric calls that I have been on, the number is between 10 and 20% is what we're being told. There was a study out of England recently published that said, I'm looking at the data so I tell it correctly, that 12% of UK children aged 2 to 11 and 14% of children aged 12 to 16 had symptoms 5 weeks after their first infection.
Wow.
So there's just a lot of data out there, and depending on what country it's coming from, it may be that 5%, it may be that 10 to 20%. The National Institute for Health, the NIH, is doing a big study on U.S. children and looking at post-acute sequela of COVID. And I think, as Dr. Dobbs, as many healthcare providers have said, we just don't know. We don't know now what these kids are going to have 6 months from now, a year from now, 2 years from now. I will tell you that I have seen in my pediatric practice children and teenagers with long COVID, with post-acute COVID symptoms and sequela. And the main thing we see things like shortness of breath, the inability to take deep breaths. For instance, one of my patients is a musician. She plays the flute, and she has not been able to play her instrument as she used to. Just because she cannot take those deep breaths, she cannot sustain a note. And so, that's just heartbreaking. That's why we don't want any kids to get COVID. Even if only 5 or 10% of them get long COVID or post-acute sequela, I mean, that's 5 or 10% of our children who are dealing with shortness of breath or fatigue or high heart rate. Another thing we want to remind parents about is they're athletes. If their child is an athlete, if they are returning to sports, they need an evaluation by their pediatrician, by their family practice doctor, prior to participating in sports again once they've had COVID, because we need to check their blood pressure. We need to talk about their endurance. We need to know that their body is ready to be back on the field, to be back on the court, to participate after they've had COVID. So we need checkups on kids after they've had COVID to make sure they're ready to return to play.
So I sort of put the cart before the horse, and then I'll turn this back over to Donna. A lot of people were shocked that Michaela was in school on August 11th and died August 15th on a Saturday. I'm hearing these stories more and more about adults and kids who seem fine, but it turns on a dime very quickly. Can you speak to how a child could go from experiencing no symptoms or, minor symptoms to a severe illness or death in such a short amount of time? What should parents be looking for? I know parents are vigilant. You're a pediatrician, you get the calls, but what should they be looking for?
Right. And I do not know Michaela's situation other than what has been reported. So COVID in kids, can present a lot of different ways. It can present with high fevers, respiratory symptoms, or it can present pretty mildly with just kind of a cough and a cold. Some kids we see even have things like a stomach ache or GI symptoms, nausea, vomiting, or diarrhea, not what you would particularly think of with COVID. So first off, if your child has any of those symptoms right now, go ahead and get tested. And that is apparently what her family did. They did get her tested. Then the second thing, once kids are tested under the age of 12, there are really no treatments out there other than making sure they stay well hydrated, watching them for any respiratory symptoms, signs of decompensation. So the things parents need to watch would be things like shortness of breath, having difficulty speaking because they're so short of breath. If kids get to the point where they're having nausea, vomiting, GI symptoms, and are not drinking and staying hydrated, so any signs of dehydration, they need to get evaluated. High fevers that will not come down with antipyretics, a high fever that doesn't come down with Tylenol or Motrin. And really, when in doubt, just have your conversation with your pediatrician, give them a call, and we'll kind of walk you through it. So in terms of her situation, what could have happened that made her turn so quickly? There are lots of things that can happen with acute viral illnesses. You can have just an acute cytokine storm, which means your body's immune system just kind of turns on, overreacts, and releases all these cytotoxins. You can go into shock where your blood pressure just drops because of an overwhelming infection. I don't know if she had respiratory illness or respiratory symptoms where she became hypoxic. With COVID, one of the things we also sometimes see is clots. We see clotting and clots that develop. And sometimes you can throw those clots and develop a pulmonary embolus. So I don't know the specifics. It's unusual for children to get so sick so quickly, but unfortunately, it does happen.
Oh, okay. It's I don't know, it's so difficult to even talk about children in these situations. So let's see, what was my question here? I just got off topic. So you were tweeting earlier today about Mississippi now leading the world in cases per capita, and how that's not surprising. And at the same time, we've just come out of this week, or coming through this week of, intense conversation and media coverage. I mean, we've been a part of that, other media in the state, other media outside the state. And, some people, maybe the governor's not as happy about the media coverage, but what I'm curious about from you is what is coming out of this attention right now, and not just the media coverage, but I mean, what do you see happening that this week, for instance, that might not have been happening last week? Where's the hope in it all, I guess?
I think that the things that are happening that are hopeful, as I mentioned before, is an interest and an increased awareness of vaccines for the ages 12 and up. 2 weeks ago today, I did a vaccine clinic at a local school in Lamar County, Oak Grove High School and Oak Grove Middle School, and the day before at Summerall High School and Summerall Middle School. Unfortunately, both of those schools had gone into virtual learning, so we had a lower number actually at those COVID clinics. But what we are seeing, because of the high rates of COVID within the school system, the high numbers of kids getting quarantined and sent home, the virtual learning, and unfortunately, the situation with that sweet girl is just an increased interest in prevention. So I'm a pediatrician. All I like to talk about, or one of the biggest things I like to talk about, is preventive medicine. What can we do to prevent a problem? An ounce of prevention is worth a pound here. So vaccines are one of the things that we as pediatricians promote on a daily basis as a preventive tool. So I'm happy to see the conversation turning back around to how to prevent this problem. I also think that the things that have happened over the last week are giving school boards and school administrators and superintendents more support when they are wanting to switch their kids to masks mandatory. There are school districts, there are school boards, their teachers, they want to do the right thing. They want to protect their kids, and they want the kids to be in school in person. So there are school boards who have been interested in using masks. However, they've gotten pushback from some parents. So I think that what has happened in the last few weeks has given school boards more leverage, perhaps, or more support for their mask policies.
Yeah, and it's kind of struck me that well, one thing that struck me about the whole thing is that there are a lot of different people. Like there are people, there are people retweeting our publication that don't always like us, for instance. I mean, people are coming together, I think, across a lot of lines. We have more state leaders who are speaking out, and like vaccination campaigns, and we can probably spend a lot of time later talking about when some of these things should have happened. But the truth, as you're saying, is that it does feel, and I'm glad to hear you say it because it's my impression that it does feel like things are happening. And I think you've already answered it, the whether or not that's translating on the ground in the school districts, because that's what's harder for us. We have 82 counties, right? So it's harder to know, other than specific counties that we decide to focus on a little bit. It's really hard to know, well, what's really happening, and is the awareness actually taking hold in those districts and helping those school boards? And it does sound like you're saying that that's true. So that feels like a big relief.
Right. Unfortunately, sometimes when a bad thing happens, it really galvanizes that community around the situation. And that's also something that's happened in the Hattiesburg area. We had, actually, we've had several moms in this area who are pregnant moms who have unfortunately passed away. That's another thing we can certainly talk about. But when you see a healthy 20-something-year-old mother pass away, it just breaks your heart. But it also brings to light the fact that this is a disease. It doesn't care what your age is. It doesn't care it's just what is affecting everyone right now. So unfortunately, when bad things happen, it does get people to be more interested in vaccinations. So that's what we're seeing in our area.
The only thing I'll say then, and I'm going to give it to Kimberly real quick, is that in the Smith County situation, when we added to our original story on it, one of the things that we had learned is that a pregnant woman in Smith County who was 20 years old had given birth to a healthy son, and she died of COVID. And so that story's kind of to the side because of Michaela, obviously, but it's just jarring to hear those things. But Kimberly, you can take it if you want. I'm sorry I jumped in there.
Oh no, I wanted to have a question, and then that will lead us to one of our, I was about to say reader questions because I'm used to saying that, one of our viewer questions. I am still seeing and hearing lots of anti-vax hesitancy, and they are using this as an opportunity to sort of co-sign on being anti-vax across the board. I've heard everything from it's the preservatives or the additives. It's not, I'm not against the vaccine. For COVID, it's, oh, it hasn't been studied long enough. There are all these sort of layers of why people don't want to get tried and true vaccines. And, you know, I I think I'm the last generation that remembers people getting chickenpox and measles. I think I am. I think my brother, who's 43, had chickenpox, and that was the last person I actually know of that age. My mother's, we have relatives that had polio. So there's this, I think the memory, sometimes when you get so far away from a really serious disease, that the generation that didn't have to deal with the disease sort of forgets why vaccines are important. Can you talk a little bit about what you're saying to parents who are afraid of this vaccine for whatever reason, but also just generally afraid of the vaccines we've all been taking routinely for decades?
Sure. So as I mentioned, as a pediatrician, we give vaccines every day. And so vaccine hesitancy is not surprising to us. We talk to parents about it all the time and answer those questions. And I think the first thing when you get someone who says, I don't want to take this vaccine or I'm against it, is to ask why. Because some people just want more information. That's one group. Some people just, have heard misinformation that you need to clear up. That's another group. And then there's a small, very small group that is just absolutely anti-vax. And those you continue to talk to week after week, visit after visit. But there's a wide range right now of that vaccine hesitant group. And so the first thing we do when we hear from them about their hesitation is ask them why and address those particular questions. Like you said, a lot of it is simply misinformation. They've heard something and it's not true. So we can address those particular problems. One thing I tell all my patients is, I have 2 kids and they were fully vaccinated on the American Academy of Pediatrics recommendation. My 2 kids are in their early 20s and they both got the COVID vaccine when it was approved for their age. So I would never recommend something that I did not have full confidence in for my own children. Every pediatrician at my pediatric clinics, all their children are fully vaccinated as well. So I think that personal story of explaining why our children are vaccinated, why we feel comfortable with that, and just finding out why parents are concerned, that is the first step. There's so many different crazy rumors out there and crazy stories that, I mean, you just have to ask them which one they heard, and then you can go from there.
You can talk through. Yeah, I think that's a good strategy. So I'll dive into one of our questions. My friend's teen daughter is in the midst of 2 doses of the HPV vaccine and a hepatitis shots. She has decided to get vaccinated for COVID, but has concerns about the timing of the COVID vaccines. Can you talk about interactions, also the flu vaccine? So we're getting our teens are starting to get vaccinated, but they also are still in the midst of some other vaccinations. How do you work all that together for the young people?
That's right. And so first off, great. I'm very glad that she is getting vaccinated against HPV, hepatitis, and is now going to do COVID. And so the CDC and the Department of Health have actually come out with guidance on that. And there is no wait time. There is no time that you have to wait between COVID and any other vaccine. The only vaccines that require a wait time are live viruses, like the varicella virus, the MMR shot, just that live virus. None of these mRNA vaccines or the HPV or hepatitis are live vaccines. So there is no wait time. She just needs to wait till her arm's not quite so sore, I guess. But.
Yeah. So we had, and then I'll turn it over to Donna. I think this question was asked 7 or 8 different times in different ways. People want their kids under 12 to get vaccinated and want to know what you're hearing about that timeline.
Yes, that's the $1 million question. And we have some people who are already putting their names on lists. So the minute we get that recommendation, they want to be the first to be called. We had heard possibly September, and then we've also heard midwinter. So I don't know. I do know they are doing their due diligence. The FDA, the ACIP is looking at all the data. They want to just make sure that all of the safety data is there before they approve the vaccine down to the age of 5. So I'm hopeful in the next few months.
Right. Yeah, that was a big question.
Now, you had mentioned before, you talked a little bit about parents being careful with their athletes, their student athletes. We have a question from a viewer about if a school is shut down and gone virtual because of COVID outbreaks, should they be holding athletic practices and games? And it says MHSAA says virtual schools will forfeit games, but now some schools seem reluctant to go virtual even when cases warrant it.
So the High School Sports Association did say that if you were virtual, you could not have games. And I think they are revisiting that because on the one hand, they don't want people to not go virtual when it's needed just because of sports. But on the other hand, if you're going virtual because there's so many cases within the classroom and the school setting, you don't want to necessarily have all those activities where children are continuing to be amongst each other and spread COVID. I will say there are some athletic activities that are very safe outside. For instance, cross-country running. That's a great outdoor activity that you can do. You can be socially distanced and you can participate in that sort of a sport safely. Things like tennis, things like golf. Outdoor athletic activities are generally going to be much safer than those indoor activities. And so I think it's just going to be whatever that school decides. But as a parent, I think you have to look at what activity it is you're talking about. Are you within a school that has a high vaccination rate? I had a school around here where their team, their class actually decided all together, an 8th grade class in a local school, they said, we're all going to go get our COVID vaccine. We're all going to go get our shot. So 8th grade class is going to be very well protected. If you have a volleyball team or a soccer team or a football team that is highly vaccinated or fully vaccinated, then you're going to be much more protected if you want to participate in that sport. So it depends on the sport and it depends on the level of vaccination within that sport.
And then that kind of reminds me of a question that we had for Dr. Dobbs. And I don't have the question in front of me. I actually think the New Yorker quoted some of his answer on this because one of the readers had said, can kids do this? Can kids do this? Can kids do this? So I don't have them all. I remember one of them was pep rallies and assemblies. And so I'll just ask you if you were going to get granular about, okay, a school is open. What are the things that the kinds of activities, you've addressed this sort of, but what are things I think that you would tell them not to do that they might normally do?
I would certainly avoid large indoor gatherings, things where kids are shoulder to shoulder, parents are shoulder to shoulder. When you yell and scream and cheer, you're spreading COVID. So indoor activities are always going to be a higher risk than something outdoor. And so the things I would say would be, can you take your choir and spread out and do that outside? Can you take your debate team and sit outside, even though it's 100 degrees right now? But at some point it's going to cool down. That's what we did last year. We had lunch where kids sat outside, and we did things outdoors. That is definitely going to be a safer and more secure location for those sorts of activities. but yeah, inside is always going to be dangerous right now. Outside is safe.
Yeah, it's just so interesting. And I understand as a parent, as a kid, you've been trying to do the right thing for a year and a half. And it's tough, but we gotta stay the course. We gotta stay the course. We've got some questions about very specific questions about masks. You can tell these are people who have done their homework. What are your recommendations of the best types of masks for children to use while at school if parents are not able to get an N95 mask? And that is Mary Kate from Brandon.
So last year, what I said was the best kind of mask for your child to wear is the one that they will actually wear. One that's comfortable, one that's cute, one that doesn't pull on their ears, one they can keep track of. So last year I said, and would have said, the best mask is whatever you can get them to wear correctly. This year, with COVID being so widespread within the school system and with so many schools not using masks, I would really add that it needs to fit well. You need to have it to where it fits well over their nose and on the side. You don't want a mask that has a lot of gaping on the side. So it doesn't have to be an N95. It can just be a mask that fits well. That is the most important thing. Something that they will wear and something that fits well.
Good. Donna, do you want to take it back? I think you're on mute, Donna.
Okay, here I am. I'm back. Let's see. I'm still pulling from the list here. There's a viewer question here. How worried are you about children in private schools that don't report COVID-19 student and staff cases, contacts, quarantines, etc. to MSDH?
That is something that we were concerned about all last year also, because there were a number of private schools who did not report their data to the Department of Health. And so really what I would say to those schools is, the Department of Health is on your side. They are there to help protect your children. We want the data so we know what's going on. I have several private schools within my area, and it helps us to know when there is a huge outbreak, because then we actually order more tests for our office. We make sure that we are prepared when those kids have gone into quarantine. We know we're going to have lots of phone calls and lots of testing questions. So when the private schools don't report, it makes it harder for their local pediatricians and their local family doctors, along with the Department of Health, to take care of them.
And then here, I'm going to kick you back to go back to the mask for a minute, because I don't think we asked this. Are the PM 2.5 replaceable filters useful in addition to a 3-layer mask? And bless our families' hearts, because they're thinking about these things. I know
they are.
Yeah.
So definitely multi-layered masks are better as well. Just like the multi-layered approach for protecting our kids, having a 1-ply, 2-ply, 3-ply is definitely better. It's just a matter of how comfortable it is for that child. And again, removing those filters, replacing those filters, that's certainly helpful and beneficial. But again, will they wear it? Is it comfortable enough for them to keep it on all day long? Just make sure that works. Parents also, before their kids go back to school, practice at home. If I know they've already done this for the last year and a half, but they may have been out of practice over the summer, but just put the mask on, make sure it fits well, make sure it feels comfortable. If your child wears glasses, sometimes they have to do a little adjusting or put a little anti-fog spot up at the top to prevent them from fogging up their glasses. So try that mask on at home, get a couple different kinds, and just whatever fits most comfortably, they can breathe in and feel good about and will wear that.
And that makes it's kind of the psychology of it too, right? Because what you're saying is that they got to wear them. And what that makes me think is, just kind of thinking about the psychology of all the complaining about the mask, that can't be great for the kids, like for encouraging them to take this kind of multi-layered approach, that kind of thing. So I guess my question is, what advice do you have for parents about how they should be talking about this crisis, this pandemic, in front of their kids as well as to their kids?
And that's a great point. I'm glad you brought that up. First of all, don't have the news on 24/7 with your children. They don't need to hear about COVID all the time. They need to be kids. They need to play outside. They need to, talk to their grandparents via Zoom or they need to do all those fun things. So don't have the news on 24/7 for your kids or for yourself. But the other thing is watch your language. Your parents have children who are listening to every single thing that they say. So if you're complaining about masks, if you're complaining about the school and you're complaining about their teachers, they will pick up on it. But if you help your child to be part of the solution, then they will feel some ownership. What you do is you tell your child, this mask is going to help protect you, but it's going to help protect your friends around you. There are children within your school who may have asthma. They may have some illness that makes it more severe if they catch COVID. So we are wearing a mask. We're doing this to love our neighbors. That is the point of all this. We want to protect our kids, but we want to protect our school. We want to protect those around us. And so I really feel that love our neighbor aspect of masking is not being talked about enough. And I think kids can be part of the solution.
So we have a question from Dr. Kimberly Smash, who's actually my doctor. I can break my own HIPAA. And she and Dr. Nina Washington, who is a pediatric rheumatologist, did a program that folks should really take a look at about Black women in COVID. They did an MFP Live. She said, I'm not sure if this question has been asked, but what are your thoughts on the virulence of the Delta variant versus the original version of COVID-19? Is this variant more deadly for the pediatric population, which is a great question.
And that is a great question. We know that it's more contagious. We know that Delta, instead of spreading to 2 people, is spreading to 8 people. We know that the number of viral particles in the nose is 1,000 times. So we know we're spreading it more. The question is, are the kids sicker or are we just seeing more children? And that is something we're still trying to tease out. I will say right now, and you've reported, others have reported, that our children's hospital is full, our pediatric ICU is full, and our pediatric ER is full. So this is what is worrisome to me as a pediatrician. When kids have any sort of illness that is going to require a trip up north for me to Jackson, we're going to have trouble getting our kids in. So we're still trying to figure out if our hospital is full just because there's so much COVID, or is the Delta variant more dangerous for kids? The other thing, just to remind everyone, and someone asked this question, that MIS-C is multi-system inflammatory syndrome of children. That is something that develops 4 to 6 weeks after COVID. And it doesn't have to be a severe case of COVID. It can be a very mild case of COVID. So our pediatric infectious disease doctors are seeing more and more patients with this in the hospital. I was on the phone with them yesterday. Normally, they have 1 or 2 cases of MIS-C per month through the last year and a half of the pandemic. Now they are seeing 1 or 2 cases of Missy a week in the children's hospital.
Wow.
And so that child requires the pediatric ICU, pediatric cardiologist, pediatric rheumatologist, neurologist. I mean, every subspecialist you can imagine.
Wow.
And they generally have a very severe. So that's what we're worried about. We're seeing a surge in kids. Our concern is not
Right.
just what we're seeing now, but what might come
Right.
4 to 6 weeks later.
Yeah, and then I'll turn this over to Donna, but I think we can't put too fine a point on, there are things that we don't know about COVID, and that there are things we're not going to know until the data tells us stuff in 5 years, 10 years, 20 years. I mean, we look at the influenza of 1918. I think I have that year right. And we're still learning things about that. And I think in our instant gratification, the instant gratification that many of us are used to with our news cycle, and the fact that you can watch all 12 episodes of a TV show, some of the frustration we're seeing from people is, well, why don't you know? Well, this can't be, then why would I believe you if you don't know? And so I think what you have said, what Dr. Dobbs has said, is we are learning so much as it happens, and we won't know some information until we can research, study, until we have data to really look at. And so I think that's really hard for a lot of people. That's why they're sort of suspicious of what is happening, is because they say, well, you changed what you said. Well, the virus changed. We learned something different. We have new information. So I think it's important to put a really fine point on that, is our medical professionals are learning with us, and they are giving us the best information they have right now. I think we have a graphic to put up. Maybe not. I will say we do have one more question that you might, is there anything that we have not talked about? One person wants to know, she talked about it in terms of the CDC, but is there anything you want our parents, our educators, our caregivers of young people, of kids to know that we have not talked about? What is it, anything left? Did you leave anything on the table? Oh yeah, that was Tanja Murphy.
So, I just like to remind people that kids don't have a voice. We are their voice. Pediatricians and parents have to stand up for them. Children are 25% of our population, but they are 100% of our future. So they do not need to be left behind. They do not need to be put on the back burner. We really need to focus our efforts, focus our resources on keeping kids safe, and getting those 12 and up vaccinated. We want our kids in school. We want them there safely. We need to do everything we can as parents, as school administrators, to do that. And we, as the Mississippi chapter of the American Academy of Pediatrics, are ready to help. I've spoken at school board meetings. Many of our members have spoken at school board meetings. And if there are any superintendents out there, any school board members who need additional help, additional resources, or an additional voice, please reach out to us, because we're here just to help keep kids in school and keep kids safe as we learn more and more about the pandemic.
Well, Dr. Henderson, I will say that this is even better than I thought it was going to be, and I knew it was going to be a really good show. So I can't tell you how much we appreciate you coming on here and just answering question after question. The one thing I'm kind of bummed that I don't, and I was serious about asking this question, but I wanted to get at least one story of you and Dr. Woodward at medical school together, because editorial comment here, we're a women-founded publication, and I, especially with this fourth wave, women are just speaking up, and so many of the people who are kind of cheering us on as we're doing our reporting in this, more than even usual, have been women. And because I think that it's something that this idea of children in schools and what's happening there, this is a moment for women to lead And so I really thank you for your leadership in this. You have one of the best Twitter feeds in the state. I just want to tell people that. Hopefully we could throw up your Twitter handle one more time as we're kind of going out here. I encourage everyone.
I started in a couple of years ago when I went somewhere. They call us tweetiatricians. Pediatricians who tweet are tweetiatricians.
I love it. I never would have known that. Tweetiatricians. Okay, I'm going to practice saying that. Thank you so much. I want everybody to go follow Dr. Henderson, follow Dr. Woodward too. And I don't know the Children's of Mississippi doctor, but it sounds like our head, I'm going to need to here in all of this. So maybe a future show here. And then to the rest of you who are out there watching and listening now, please share this. We get a lot of viewers after the fact. And please, this is one of those shows like Dr. Dobbs' show that we just need out there. You're going to be seeing clips from this show on our social media. It's going to be a podcast, probably a transcript, just like we did with Dr. Dobbs, because we want, these particular shows are real public service shows. We want to get the information out there, answer as many questions as possible, give you guys good sources of information. And this certainly was a wonderful show. So please get it out there. You're welcome, Tammy. Thank you for commenting in every way you can. Remember, it's on YouTube. It's on Facebook Live, and now it's on our podcast, which is on, we'll be tweeting it, but it's on Simplecast, right? Apple.
It's on Spotify and Apple.
And Spotify and Apple. So you guys can follow our podcast. So please get this show out there any and every way possible. Also, as you know, we are a nonprofit media outlet. So if you can throw any change in our tip jar after this at mfp.ms/donate, we will be more than appreciative. It's also Kimberly's 50th birthday month, and she is asking for $50 for her 50, if you can afford that, or $5 or $500
or $500,
whatever you got, whatever you can do.
It's tax deductible.
That's right. And most of you know that we've got some, our journalists, our reporters on COVID this last week has been phenomenal with the work that they're doing. So, everything that every way you can support us, every dollar helps us grow that journalism. So thank you for your support so far. And please keep sharing our stories. Also, Kimberly told us that we had to do this Instagram live happy hour this week. We're beta testing it, and Ashton Pittman is going to be joining us, and Kimberly's going to be interviewing Ashton and me about what's going on with COVID, but particularly around our COVID coverage recently. So hopefully you guys can join us on, was that Wednesday before it went away? Thank you. August 24th, 6 p.m. Central Time. And I think that's all we have for this week. We'll be letting you know who our guest is for next week. We're still trying to confirm. So you guys keep an eye out. And Dr. Henderson, thank you. Thank you for your service. Thank you for everything that you're doing for Mississippi. We all really, really appreciate your work. And thank you for being here.
Thank you so much for having me tonight. I really enjoyed it.
Thank you. And we will see y'all soon. Take care.